I know that James Davis has now got some questions.
Thank you, Chair. Prerana first, if I may, just as an overview to understand how you feel the current level of well-being of those who work in the NHS actually is, and how do you monitor the good as well as the bad aspects?
I was just going to open a couple of stats. Thank you for that question, Mr. Davies. So we have been constantly engaging with staff to see how they are feeling, and it's at a national level, but it's very much at an employer level as well, of course. And we have chief execs, and Claire is here to share her experience, where every manager and leader is engaging with staff to see how they're doing. And we're actually supporting managers to spot signs of either distress or fatigue, because that's the best place to support people. So since 1st of July, we have been running a fortnightly People Pulse survey from the center. We've had almost 22,000 responses across 77 organizations. It's an opt-in survey, so we're not mandating and adding sort of more reporting onto employers and staff. This is, of course, in addition to our national staff survey, which is currently live. So across the 4 surveys, we have found that a majority of staff, so 61.6% of staff, have felt able to have a work-life balance, whereas around a fifth, 21%, have not felt able. 2/3 of staff, 67.6%, have said they feel supported by the health and wellbeing offers across their local organization as well as the centers. This was 30% in the last staff survey. So feeling supported for their health and well-being went from 30% in the last staff survey to 67.6% in the last couple of months. 67% of staff feel their organization is proactively supporting their health and well-being. And I think this is an outcome of COVID that we absolutely want to capture and make sure that we're not rolling this back, because it wasn't the case pre-COVID in terms of that support. We're also listening through our health and wellbeing offer nationally, as I mentioned. So for instance, we just launched a financial wellbeing offer because people have shared that secondary stressors, because of course we're all part of this, NHS staff have the responsibility that they have at their jobs, but also every individual has responsibilities at home. And people have shared that the secondary stressors are also what they would appreciate support with. So financial wellbeing offer or launched on the 1st of October with a money advice service to provide support for advice on pensions, savings, and financial issues and questions, which, as we see the impact of COVID on jobs of partners and families, that's coming up as a key issue. So we are constantly looking to how we can support. For instance, it was mentioned earlier, the impact on the Filipino nursing community. So we have set up a specialist bereavement counseling service in Tagalog for our Filipino colleagues. We also have a wider bereavement counseling service. So the number of, the helpline number works as a front door, and people are signposted to different types of support needed, and we have a constant feedback loop from there as well.
Okay, thank you. So some positive news there. There's a health and wellbeing conversation and personalised plan that have been promised from September. Could you outline how that's been achieved and the level of rollout, please?
So this was, thank you. When the pandemic started and we saw the disproportionate impact of COVID on communities from a Black and Asian minority ethnic background, PHE took up the community impact, and we led the support for staff. From there, so I convened every 6 weeks since April, I have convened a national meeting of all of the BAME staff network leads and EDI leads across the NHS. And out of that conversation came an idea and a suggestion to have an individual risk assessment conversation. So 96% of at-risk staff have had an individual conversation. Building on that, we then have expanded that idea to saying that every member of staff should have a health and well-being conversation, not only those staff who are at risk. So we already have more than 1 million conversations have taken place in the last few months, talking about, what flexibility do people need? How are they feeling in their teams? What support do they need? What reasonable adjustments should be made? Is there something on how the PPE fits for them, whether it's a headscarf or a beard? It's those kind of elements that we want every individual to have a conversation on. And so we are tracking that through systems. Each system, and I did catch the conversation earlier with on the people plan about the need for more detail on implementation. And if I may offer that the health and wellbeing conversation is being tracked similarly to the other commitments in the people plan, which is as part of the planning guidance for systems, service or activity levels, financial goals, as well as the people plan goals. All three have been asked for from every system. They have sent it in. We have gone through every one of those 44 submissions and are tracking it with systems and employers.
Thank you. And are you satisfied that the discussions taking place locally are with people that staff are happy to open up to, particularly if there have been concerns over bullying?
It's a very, very big question. And I would say, with 1 million conversations, that some would have been done really with a lot of skill and a lot of compassion and empathy. And the feedback is that some were less empathetic than we would have, or than people would have liked. This is a huge, huge step forward. It's a necessary step forward. It's not a sufficient step forward. So I think line managers, occupational health teams, all, I would urge everybody to place a huge amount of emphasis on having both the cultural competence as well as the line manager skills to be able to have what is quite a sensitive conversation. And I would want people to be assured of both their psychological safety as well as employment safety.
Thank you. And finally, to Claire, further to the announcement you made just before, do you have the ability to attach any timescales to the provision of the mental health support services for staff? And also, can you give some reassurances about the capacity to actually deliver those services?
Yes, thank you. It would be true to say that back in April, I asked mental health trusts across the country to work in their ICS systems, in their local systems with ambulance, acute, community, all trusts, to see what their psychological and mental health needs were. So many systems across the country, in fact most, now do have a form of rapid assessment and treatment in place. They just did it. They just did the right thing. And what we're seeking to do is obviously shore that up and build on that. So we're not starting from nowhere. In fact, all but 6 ICS systems in the country, or of the 44, have something in place already. So we're going to shore that up, close the gap around the 6, and I think we can move very fast on this. It's something, as you would expect, that mental health service colleagues feel very passionately about. They absolutely want to use their skills in addition to seeing patients to treat their own colleagues. So capacity is always a problem. The NHS, we're busy, but I feel very confident on the basis of what services have managed to deliver to date informally that we will be able to ramp up very, very quickly. In addition, we will be setting up a highly specialist national service for the small number of staff who perhaps have very complex trauma, perhaps some of my critical care colleagues. So we'll be working with another provider on that highly specialist delivery as well. But I feel as confident as it's possible to that we'll be moving very fast on this. I mean, I've been in touch with chief execs across the country and had the most incredible examples of who they're seeing now, what the issues are, how quickly they're able to respond, usually within a day or two, for colleagues to help address suffering, but also help people stay at work or return to work. So I'm cautiously optimistic that we will be able to move very fast indeed on this.
Thank you. So, for instance, in Merseyside, where there's a COVID hotspot, if staff need support in the coming weeks, that will be available?
It will, and I was talking to chief execs in Lancashire and in Merseyside, in fact Merseyside only yesterday, who've sent me the most impressive range of materials available in terms of support and access. So we'll be looking at those high pressured hotspot areas first to make sure that, in a sense, although this rollout will be rapid, we'll start where we think it's needed most.
Thank you very much.
Thank you.